The CDC says more than 100,000 Americans overdosed on drugs last year, which is a 15% increase from the year before. And it's no secret Colorado is dealing with opioid addiction in many communities. Deaths related to opioids surged more than 300% between 2019 and 2021. That's according to the city of Denver. The Office of the Medical Examiner tells us that already this year, 216 deaths in Denver are linked to drugs. And that's why HealthONE is hosting its 4th annual Opioid Takeback Day this Saturday, which coincides with the DEA's National Prescription Drug Takeback Day. So joining me now is ER physician Dr. Stader from Swedish Medical Center. And Doctor, tell us first of all what this day is all about.
This day is really about protecting our communities. We know that opioids present a clear and present danger, whether that's illicit fentanyl or prescribed opioids that might be in a medicine cabinet. And this day is about bringing those medications that you are unused or not using back to us so we can safely dispose of them and keep our community safe. Absolutely.
And as an ER doctor, how have you seen the opioid crisis impacting Colorado communities?
Oh, it's been devastating. It's a tragedy that we see on a daily basis. People who struggle with addiction and drug use, who we need to get into treatment. And then other times accidental use where people might be thinking they're taking something else, whether it's Xanax, et cetera. But if it's an illicit source, oftentimes those are contaminated with fentanyl. So we've never seen more overdoses than we're seeing right now.
Yeah, it's been scary for many people and communities. What kind of prescriptions can the public take to this event to dispose of?
We're looking at mostly controlled substances. So things like opioids that might be Percocet or oxycodone, hydrocodone, unused fentanyl patches, unused methadone, Dilaudid. So there's a lot of different types of medications that they can bring back, including things that are non-opioids but still dangerous if they're in a medicine cabinet. So things like benzodiazepines. So all of those things, if you're in your medicine cabinet looking around and saying, wow, I've got this from after surgery and I've never used this, we'd ask that you bring it back so that we can safely dispose of it.
And tell us, too, why it's important to safely dispose of it and not just, toss it in the trash can, why they should bring it to you guys.
So there's two reasons here. Why should you not just toss it in the trash can or flush it down the toilet? One is because that then poses a danger to the environment when these things get into the drinking water or when these things get into trash bins where they can be diverted. The other reason is the more important reason, is because it keeps your family and community safe. We know that many adolescents and toddlers will sometimes get into medicine cabinets. And if they take one of those leftover medications, that could present an emergency or at most a death, which would be absolutely tragic. And then we know that oftentimes that people's first exposure to an opioid is from medicine cabinets, where they're kind of still just floating around. So in terms of keeping your family safe, your community safe, it's really important that we get these medications out of the home.
Absolutely. Well, thanks so much, Doctor, for all your advice. We really appreciate it.
So thanks for the opportunity.
Absolutely. And again, the Opioid Takeback Day is this Saturday, October 29th. You can find a list of the drop-off locations on our website, cbscolorado.com.